Want to welcome you to our weekly briefing with the press. Want to remind all reporters to make sure that you ask for permission to record. In addition to that, if you do have questions, please indicate in the chat your name, as well as the news organization that you represent and who you would like to direct your questions to. As we do each week, we start off with County Executive Elridge, and then we'll move through Dr. Gales and through Dr. Stoddard. So without further ado, we'll start off with County Executive Elridge.
So good afternoon, everybody, and welcome again to the weekly briefing. I think, as you know, we issued and the council approved the new executive order on Tuesday that reopens indoor dining at 25% capacity, and patrons are limited to a 90-minute dining period. Alcohol sales also must end by 10 p.m. And this order is going to affect on Sunday, February 14th. Based on the latest data, there are more people in Montgomery County been vaccinated than anywhere else in the state, and we have over 94,500 people vaccinated in total. If you add the 14,000 people who are vaccinated outside the state of Maryland, county residents vaccinated outside the state of Maryland, we have over 109,000 people who have been vaccinated, which is about 10% of our population. And our local health department has vaccinated more people than anywhere in the state. We've done over 32,000 first doses and over 46,000 first doses and second doses combined. Our health department continues to do a good job of getting the vaccines into people's arms where they belong. Our focus in the county continues to be on 75 plus residents who are in the hardest hit areas. We're now in partnership with hospitals to provide more doses in the community. And the challenge continues to be the very low supply of vaccine available to the county and the state. We understand that people are eager to get their shots, but there's just not enough vaccine. The state is receiving about 88,000 doses, which is roughly 12,000 doses a day, a little bit more than that. And that goes for the entire state. The reason why this is important is because we are focused on the 75 plus group, and the reduced quantity that has come to the county does not enable us to vaccinate this group fast enough. We've been able to vaccinate about a third of the people in this group. We are getting this week, about a third, actually for the last couple of weeks, about a third of the supply that's allocated to the county is coming to the county health clinics. The 75 plus group, which is group 1B, was the highest priority group of residents outside of the essential workers that were in 1A. With the county only getting 5,000 doses a week and nobody else who's receiving doses, remember there are about 10,000 doses going to other providers in the county as they are throughout the state, only the county is obligated to try to get this 75 plus group vaccinated. We are working with the other providers to see if we can coordinate on this, but it will be a very long wait for people if we have to rely on the amount of doses that the county itself is getting in order to vaccinate this group. It is one of the problems with the state scheduling system because it doesn't create any priorities for vaccines. It simply says at this point, if you're in groups 1A, 1B, and 1C, then you're eligible to get vaccinated. And you can go on the state website and you can sign up in a clinic and you can get your vaccine. That means in Montgomery County, people in the groups outside of 1B, outside of the seniors 75 plus, are using vaccines that had originally been intended on focusing on the 75 plus group. So it's creating a mad scramble for doses, which is not good. It makes it impossible to prioritize the 75 plus group. And in fact, if this continues, will make it impossible to prioritize any group. And that we view as problematic. Obviously, the 75 group has the highest mortality rate. They were made the first priority for a reason. And we would hope that the scheduling system can be adjusted so that that priority is reinforced by how scheduling is done. Montgomery County continues still to have too many residents who are getting notification of the ability to register for a vaccine on the county through the county clinics, and people are still sharing their invitations with other people who are not eligible. That is creating, it's creating a mess in terms of who actually can get vaccinated when people who aren't eligible show up with appointments, and 75-year-olds aren't able to get appointments because those appointments have been taken by somebody else. We continue to work with the state on this. I raised this in my meeting with the governor and his officials a couple of weeks ago. I know they're working on the software. I think they understand the problem, but until that problem is resolved, we're going to continue to get far too few doses into this older population. According to the state's last report, 587,000 of the state's 6 million population has been vaccinated with the first dose, which puts that at about 9%. So far, between the hospitals, pharmacies, and county-run vaccine clinics, over 27,000, so I got that number a little bit wrong, it must have been yesterday's number, 75 plus have been vaccinated, and over 14,000 people between the ages of 65 and 74 have been vaccinated. If you are part of the 300,000 people who are now eligible in Montgomery County, you are waiting for us to distribute an allocation of about 15,000 doses each week. So to put it bluntly, the first week this happened, it was 300,000 people waiting for 15,000 doses, which means there are going to be 285,000 very unhappy people who don't feel that they were prioritized. This is the problem, again, with making everybody eligible when the supply is as low as it is. We would love to make these vaccines eligible to everyone. We just don't have the supply to do that. The good news, more doses are going to be produced. More companies will come online. This is not a permanent condition. This is the condition in the moment we're in right now. But people have to understand that in this moment, the biggest barrier to our doing vaccinations is the number of doses we have. On the bright side, our case counts have been trending down for the last few weeks. Today's cases from yesterday, number of cases was 159. Test positivities dropped to 4.39, and cases per 100,000 is now down to 18.74. It's a downward trend. We hope these numbers hold, and we'll be looking very carefully, I assure you, at what happens to these numbers when dining opens up again. We're making this effort, and we're hoping that dining can be done safely. I cannot emphasize enough to patrons who are going out to restaurants. If you want to continue to do that, you need to mask. You need to probably double mask, which is the new guidance that's coming out of CDC. When you're sitting at a table talking and not eating, you need to have a mask on. It is just simply not safe to be in a restaurant unmasked. It's not safe for you, and it's not safe for the people around you. So please be careful. From last week's press briefing, we had 147 cases. Our test positivity rate was over 5. It was 5.22, and our cases per 100,000 were 23.85. Then 2 weeks ago, our cases were 359, positivity was 591, and cases per 100,000 were 33.7. So you can see the progress we've made, and we hope we continue to make that progress. As I was saying before about the shortage of vaccine supply, there are approximately 2 million people in Maryland who are eligible for doses in just phase 1. That's phase 1A, B, and C. And the state right now is getting about 88,000 doses per week. This is the largest allocation they've had, apparently. So 88,000 into 2 million is a very long wait. Residents who do not have access to the website and need pre-registering are advised to call the vaccine pre-registration assistance line. This line is available 7 days a week from 8 a.m. to 6 p.m. And the assistance helpline number is 240-777-2982. This is a line to assist people who are having trouble pre-registering online or who don't have access to a computer. This line is not to place a call with questions about where to go to get vaccinations. That information you can get from the website. If you know someone 65 or older who does not have a computer, please help them register, particularly in our Black and Latino communities, which on one hand have been the hardest hit communities by the virus, and on the other hand are getting vaccinated at a disproportionately slow rate. We're in a very tough time, and the process of pre-registering and trying to find the available vaccine is confusing and frustrating. I totally understand that. I share your frustration, and we're working diligently to get the doses we receive out through the county health department. I get a lot of email from people. There seems to be an assumption out there that if only the county or the state tried harder, there would be more vaccines. We want to be honest about this problem. When the previous president had the opportunity to buy vaccines, he did not buy enough vaccine. And those companies, which had capacity beyond what the United States was able to buy, wound up selling their doses someplace else. So doses that could have been in this country and could have been helping us now are someplace else. New companies are, like I said, coming on, and the existing companies are ramping up production. This situation will change, but people are going to have to be patient because there's no magic wand, and there's no ability at the state or county level, and frankly, at the federal level, to make new doses magically appear. So thank you, and look forward to your questions later. I'll pass it on to Dr. Gales.
Good afternoon, everybody, and happy Thursday. As always, I hope you and your families are continuing to stay safe. I do want to echo the sentiments that the county executive mentioned in terms of we have seen continued improvements in our community transmission levels, as evidenced by our improving test positivity rate, as well as our case rate. Again, we are cautiously optimistic about these numbers, particularly given that we continue to receive reports from the national level of the presence of COVID variant strains that are more contagious within our particular communities. We don't have any updates on new cases reported from where we talked about several weeks ago, but we do continue to remain vigilant about the presence of those strains within our communities in terms of how we move forward in offering guidance related to other activities in terms of restrictions and so forth. I would actually like to take a moment, though, to comment as this sets the stage for questions related to vaccinations. As the county executive mentioned, we have been distributing our vaccines at an extremely high rate. We navigated some tough issues last week dealing with weather, but we have use that as an opportunity to retool our strategy in terms of increasing outreach to the community, particularly making sure that, again, there's a fair, equitable distribution of vaccines that are at least attempting to hit and get good penetration within those communities that have seen significantly higher COVID-related cases as well as COVID-related deaths. So in our efforts to do that, I want to highlight a couple things. We received a report this morning that there were hundreds of cars who showed up at one of the vaccine sites. As evident as apparently there was a link share. Two things happened. One, that there was communication to groups that we had open vaccine sites. We've not had open vaccine sites so far, and we've been very clear in terms of having to utilize a scheduling component in order to get those appointments. The governor has been clear about needing to do that. We've not had open vaccination sites. So there were apparently a significant number of folks who showed up at one of our sites today and were not happy when they were turned away. That is not consistent with the system that we have widely publicized in these briefings on our county website and in numerous other venues to talk about how we administer the vaccine through those sites. We also have received numerous emails this morning of, yet again, individuals who are not eligible based upon the criteria that we've been clear about at the county sites, as we have prioritized 75 and up, showing up and being turned away. We've been very clear about the priorities within which the county sites are utilizing, and we have also been very clear about the numerous other places and opportunities within the community, as the county executive laid out, that individuals may get the vaccine. So I just wanted to clarify that and make sure that folks at home understood that. We continue to work hard to make sure that we are getting good vaccine uptake and making those appointments available to those who are over 75 years of age. Now, the other thing that I want to comment on, and I will say that I will take a moment of personal privilege and professional privilege to address a couple of concerns. As a health officer, we have, as a public health official, we have absorbed a lot of criticism, to put it mildly, in terms of our jobs and what we're trying to execute and do. The health departments, particularly here in Maryland, have made great strides in terms of ensuring that our residents have access to timely information when we find it out, as well as, from all levels of the pandemic response, from testing opportunities to now when we talk about vaccination, and helping provide guidance to our elected officials in terms of making other decisions related to businesses, schools, et cetera. We've come under a lot of fire, and we are a convenient punching bag, if you will, when things don't go well. But that's not fair to us, and it's not fair to the thousands of first-line responders who are part of health departments who are working in our communities to stand up and make sure that our residents are safe. Now, we have provided as much guidance to the state as we can, particularly as it relates to vaccine-related issues. We still do not find out our allotments until late. It's Thursday afternoon, and I can't tell you how many doses that the health department in Montgomery County or any other venue in Montgomery County will receive for doses next week. That limits our ability to be able to consistently stand up clinics and provide timely information to you as our residents. So we recognize your frustration because we share a lot of that frustration. We do know that the governor is having a press conference in about an hour and a half. Unfortunately, I can't tell you what those comments will be, as unfortunately, oftentimes, health officers are not included in those conversations. So what I'm saying is, we recognize your frustration as our residents, and we're doing everything we can to get information in a timely manner so that we can put it together in a comprehensive, cohesive manner to deliver you the services that you deserve as our residents of our jurisdiction. So while we continue to advocate on your behalf, we do hope that you remain patient with us as we continue to work with the resources that we have in order to put out a product that is worthy of being accepted and meets the needs of you as our residents. Now, the last thing I'll mention related to vaccines is we are moving forward with this week putting out an opportunity to be able to partner with our community partners in identifying other venues within the community that are high volume places where individuals who are over 75 live, work, play, or utilize resources. We have cast a broad net and are working with our minority health initiatives and program, our municipal leaders, as well as representatives of other agencies, including those related to housing, to identify places and venues where we can ensure that by standing up opportunities for vaccination, we'll increase the percentage of those in that category covered, as well as make sure that this is spread out in an equitable manner that addresses the groups that have been disproportionately impacted by COVID-19. So please stay tuned to those as we announce those opportunities and move forward and make those opportunities available. And please do rest assured, our goal as your health department is to make sure that we are delivering you resources in a timely manner and making sure that we address all of those concerns related to equity and fair access that we know exist in our society. Thank you, and happy to answer any questions you all may have.
Good morning, good afternoon again. Sorry, I have just a few comments I want to add before we go to questions. We continue to work on the enforcement and education side of the house as well, doing education and enforcement, not just at our soon to be open indoor dining opportunities, but also our large big box stores and retailers, as well as on our construction sites through our Department of Permitting Services. And so I wanted to just provide a reminder that we continue all of those activities, and we'll continue to do those throughout the pandemic to ensure that there are safe opportunities throughout the county and that workers are kept safe as well. That is obviously a major priority of the county executives, to make sure that working people are protected when they're asked to show up and deemed essential. And so we are really trying to work collectively to ensure that that happens. and we'll continue to do so. We also continue our seeking FEMA reimbursement through FEMA, and obviously have worked very closely. We're meeting with them on a weekly basis at this point, FEMA that is, to try and further identify opportunities for additional dollars to come into the county. We are grateful of the dollars that the state has helped identify for the vaccination effort and related to the county. We've received, I believe, through HHS, approximately letters of approval for about $10 million so far. We expect that to continue through the rest of this vaccination period and on to later. Unfortunately, the dollars can only be utilized so well when the vaccine is the limiting factor. We do anticipate that will become easier as more vaccine becomes available. We'll be able to utilize those resources to get more vaccine out. But obviously, the vaccine availability continues to be, as has been said by the county executive and Dr. Gales, to be the rate limiting part of all of this process. And so as we have more available vaccine, we will have the available resources to get them out. Today alone, we have nearly 5,000 appointments across all of our vaccine opportunities. And so whether that's through our public safety partners, the two large sites that the Health Human Services operating, and some healthcare workers being covered at the Dennis Avenue Health Center. And so that gives an illustration of what we're capable of doing on a daily basis. And obviously just need more vaccine to be able to do that on a more regular basis.
Thank you all for your opening comments. Just to let everybody know, we have a hard stop today at 1 o'clock. Our panel has to actually have some other events that they're going to. So I'm going to ask you to please be fair to the other journalists here on the phone and limit your follow-ups as much as possible so that we can get everybody's questions in. I do see a very rare occasion where Chris Gordon has been trumped twice. Two people have beat him to the punch. So we'll start off with, and I know I'm going to say her name wrong, even though I've heard it 1,000 times. Aisha from Fox 5 has the first question, and it's directed to Dr. Gales and the county executive.
Thank you. Yes, you got my pronunciation just right. Thank you so much. All right, so we just heard about this, but Dr. Gales or Dr. County Exec, if you want to answer this, but it looks like, many teachers who were initially able to sign up and get appointments for the vaccine apparently are getting turned away from their scheduled appointments at Richard Montgomery High School. I'm sure you probably have heard about this because apparently the county is still only vaccinating seniors. I know the county exec touched on this in the beginning, but I did think it's just a little bit interesting that they were able to make these appointments in the first place. While I'm at it, I'd like to get my second question in as well. I guess, when do you anticipate getting to the next phases of the vaccine to at least include the 65 plus? I'm asking this because, I also want to know how many doses has the county, they have to throw away at the end of the day at the clinics that were being held at Quince Orchard and Richard Montgomery High Schools. Again, I'm asking this because these are places we have covered where we know people have been turned away.
So Aisha, let me clarify your last statement to make sure folks at home understand. We're not throwing away doses. So there aren't doses that at the end of the day at Quince Orchard or Richard Montgomery, they're not being thrown away. And so I've heard that in a number of conversations and I've seen that in emails. That's just not true. So let me be clear about that and emphasize that for anyone watching at home, for sending in any future emails, we're not throwing away those doses. Now, to go back to the first question, we addressed the issue with teachers who were signing up even though they were not eligible for the county sites several weeks ago. And we've been very clear moving forward that we have created opportunities working with our community partners who are offering the vaccine to offer the vaccine to educators and teachers and staff within that. We've talked very openly about the efforts started with Johns Hopkins and the suburban hospital to provide thousands of doses to educators. That has included public and non-public school staff. As well as other the hospitals who have stood up clinics as well. And so that also includes any individuals who are over the age of 65. We've been very clear about that, is they can access the vaccine at all of those other places. Because of the limited doses that we've received in our effort to address the needs of those over 75, the county apparatus, though, is prioritizing those over 75 right now. And so for teachers who are signing up, we, again, be very clear, let no one make any mistakes about this. The county apparatus is prioritizing any individuals who are left over from 1A who need vaccination, as well as those over age of 75. Now, the second question that you brought up is an important question that we're trying to triage and that we've tried to work with the state related to the PrEP mod issues. PrEP mod being the registration tool that is used by the county, it's required by the state for folks to register. We continue to see instances where folks are sharing the link inappropriately. We received an email this morning about how, from another county official who said on their community listserv, someone had posted the link and it's been a free-for-all of people trying to come in and click and come in. So we've tried as best as we can with the limitations of the system, and to the credit of the state, they took this feedback not only from us, but every other jurisdiction who's experienced those issues. And they have created some efforts to try to fix the system to address that issue. And I know one of them was creating a mechanism so that the link would only be, if I send it to you, Aisha, you get the link, you can't forward it to someone else, or if you forward it to someone else, the link is dead, if you will, and they can't go in and register. So we're trying those different strategies, but we are asking our community folks, we've been very clear about who's eligible and who we're prioritizing at different sites. And if you know that you don't meet that criteria and yet you still register, how can you be ultimately upset when you show up to the place and we remind you that you're not eligible to receive that vaccine there? And in fact, you're creating a system where you're taking an appointment from someone who does meet the criteria, and that slows the process down from moving forward. And that gets to your last question. We don't have a magical time frame because, as the county executive mentioned, we still are, finding out late in terms of the allotment of doses we're receiving. And we don't have full transparency from the state in terms of where those doses are going. So for example, the state's average doses have been somewhere between 70 to 72,000. The new administration, the Biden administration, has increased the doses coming to states. And for example, this past week, the state had, I believe, somewhere between 88 to 89,000 doses. And so with that comparable increase, the doses provided to health departments actually decreased. And we know that they're potentially being used to stand up mass vac sites and to go to retail pharmacies and so forth. Unfortunately, we don't have any further detail in terms of the number of doses being provided to those different sites. So I hope that answers your questions, but I don't know if County Executive Elridge or Dr. Stoddard have anything.
So I'd like to throw a number at you. If the county were to get 5,000 doses a week, and if every dose stayed where it belonged, which is targeted on a 75-year-old, and if the other 10,000 doses to the county just go anywhere they could possibly go, it would take the county at 5,000 doses a week about another 10 weeks to finish the 75-year-olds. If half the doses going to the other providers in the county, like the hospitals and the pharmacies, if they would target half of their doses along with what we have, and if we've maintained our 5,000 doses, then we could probably get through the 75-year-olds in 5 weeks. This is the problem of making 300,000 people eligible for 15,000 doses. You can ask me how fast I can get to the end of this line, but when anybody can register and there is no priority, so 64-year-olds are in fact, 65-year-olds are getting vaccinated in Montgomery County. If there's no priorities, there's no telling when I get to the line. If the more people who come in, like Dr. Gale said, who should not have gotten the dose because they weren't 75 years old, the more of those doses that come out of my 5,000 allotment, the even longer it's going to take to get through the 75-year-old. That's why it's so important for people not to do something they were told they shouldn't do. And hopefully the state will fix it with a unique identifier. And then I would just say to somebody who doesn't get it, that if you pass out your invitation to somebody and they register with your unique identifier before you do, you may be the one that doesn't get your vaccine. So people need to follow the rules and hopefully the state can deal with the registration piece of this, so this returns to a more orderly process. But it's not orderly right now, and the county doesn't have the ability to impose order over all 15,000 doses.
The last piece I will add is just the numerics on this. The collective system of Montgomery County residents of all sources have vaccinated 27,791 seniors over the age of 75. That is approximately 38.1%, meaning that we still have another 62% of those seniors, 45,000 to cover before we move on to additional phases. And so I think those are the numbers. As much as we hear about others outside, teachers wanting to get vaccinated, 65 to 74 wanting to get vaccinated, postal workers, grocery store workers, we hear just as many seniors over the age of 75 who have not gotten an opportunity yet and are desperate to get one as well. And so for every appointment that gets taken by a teacher, that is an appointment that a 75-year-old is not getting. And right now we've prioritized the group that has had the highest level of fatalities in this entire event. And that's just, I mean, that's not just Montgomery County, that is CDC guidance, even the state of Maryland's first priority group is 75 plus. We just haven't gone beyond it and tried to sprinkle the fairy dust broadly across the entire system. We've stayed focused at the county level on that group that is the most at risk.
Do I have a second to pop another question? Sorry, real quick. I guess, then speaking of teachers, how do you help ease parents?
Jordan, excuse me, I have to move because we only have about 20 minutes left and we have some other questions. If we have a chance, we'll come back to you, okay? I have Jordan from my MCM with the next question.
Thank you so much. MCPS announced they will begin to bring some students back to in-person learning in March. Now, when it comes to health metrics not being met was the reason and the cause of the delay of the return before. Are there any updates from the county level regarding health metrics for residents, such as cases in children going down? And do you guys have any comments on the gradual return to in-person learning for students overall?
So we haven't provided any additional edits to the metrics that we recommended back in the fall. And in fact, the numbers are trending in that direction. We have had follow-up conversations again based upon new information that has come in from other jurisdictions who have opened up, where we have been able to identify some best practices around how some places have been able to successfully keep schools open or open schools up at higher levels of community transmission. At the same time, we've also seen other jurisdictions that haven't been successful. So what we continue to do is to provide guidance and recommendations, including, for example, one of the things that we have been working with MCPS on for a number of weeks now is incorporating surveillance testing for their staff and students to some degree to roll out, so that when they do bring students and staff back, they do have a testing mechanism in place to identify any potential cases quickly and remove them from any potential transmission before they come back into the school setting or the classroom. And so that's one of the strategies that they've been working on for a number of weeks now to implement as they move forward. And I do think what also is one of the other game changers that's different from where we were in the fall is the fact that we do, even though we've talked about limited doses, we do have vaccines available. And I do firmly believe that it's important to provide that level of protection to teachers and staff members coming back into school as a part of a successful reopening strategy.
And I'll just add that, as a former elementary school teacher, I am very aware of the situation that teachers are in. I am hopeful that they will make sure that the teachers coming back to the class first, which appear to be in the elementary grades, are able to get their vaccines. I think it's important that they get vaccinated. Younger kids are probably the least likely to grasp the seriousness of what we're talking about, the most likely to do something which wouldn't be optimal from, I think, public safety perspective. And though children tend to suffer fewer and more mild cases, it doesn't mean they don't get infected. It doesn't mean they don't spread. And if the teachers aren't vaccinated, that is where things will spread. And so I do want them to do this as safely as possible. We're waiting for the federal government. They've promised guidelines this week on what you need to do to make a room safe. I actually asked the governor's staff several months ago to see whether the University of Maryland and Johns Hopkins could model rooms and determine what kind of air handling system or what kind of improvements that you could realistically make. Not if you had no limits on any money and you could spend all the money in the world, what could you do? But what could people do within the confines of a typical room to move the air in a way that would minimize the concentration of virus in a room? That didn't happen. I am hoping that there is some science out there that the Biden administration will bring forward that can direct people for what exactly to do to be sure that what we're doing in classrooms is safe and that we're able to minimize the viral loads, which inevitably will exist. There's no way you're not going to get COVID virus particles in a classroom. The question is, can you keep the loads down? Can people keep masks on, and can we keep people safe?
Thank you.
Okay. All right. Thank you. Our next question is from Chris Gordon, NBC4.
Yes, thank you very much. You are undoubtedly aware from emails and conversations about the frustration that people throughout Montgomery County have trying to get registered, get an appointment. Some have told me they've registered on 5 to 8 sites. They spend all day or 2 days in a row clicking, trying to get in. They're frustrated. Is there any thought being given to any mass vaccination sites in Montgomery County? That's the first part of my question. And
Chris, how would that change anything? Seriously, if I've got 15,000 vaccines and between us and all the providers, we can put out 15,000 vaccines, how would creating a mass vaccination site change any of that? And the states created, 6 of them. They could put one here tomorrow. The fairgrounds have already agreed that, at least they came to me and said we could put a site on the fairgrounds. If the governor wants one in the county, we're happy to do this, but it doesn't solve your problem. If you can't, are you going to take walk-ups to the fairgrounds while seniors are sitting at home trying to manipulate the computer to try to get an appointment for one of my 5,000 doses? There's no solution that you get out of opening up a fairground. It won't produce more doses of vaccine.
And I just wanted to follow up on Dr. Gales. You said at the end of the day, when you turn people away, as has happened at Quince Orchard and Richard Montgomery, you don't throw away those thawed vaccines, which have limited hours of shelf life. What do you do with them?
So part of what we do, and to add to what the county executive mentioned, so we have presented the state multiple options in terms of if they do stand up a mass vac site here, including the fairgrounds. And we presented that informally as well as formally when we had representatives from the Department of Health who presented to our county council on Tuesday, if you go back and take a look at that. So the state is aware of the capabilities and capacity that we have as a local jurisdiction to be able to stand those up. Now, as it relates to the doses that we have, because of the type of vaccine that we have and utilize at the county sites, they have a longer shelf life than, for example, the Pfizer vaccine, that once you thaw them out, you can't freeze them back and use them. And so we take extra precautions to make sure that all the vaccines are stored properly and kept at the appropriate temperature. And so doses that aren't used, particularly in one day, are utilized in our remaining clinics throughout the rest of the week. So there is not an effort where we are out throwing away doses at the end of the day. Again, I just want to clarify and emphasize that for folks at home to understand that. Now, there are certainly, parameters which we try, to make sure from a quality assurance perspective, we follow. But yeah, we're not tossing doses in the trash can at the end of the day. We're repurposing them in our future clinics.
Thank you.
All right. Just a reminder, folks, we have 13 minutes left. I have 4 questions remaining. Reporters, please try to keep your questions succinct for these last questions. The next question is from Kate Ryan from WTOP.
Okay, very succinct here. Just to follow up on Aisha, are you saying that the only way that people are being turned away because they didn't qualify is because they shared a link, or is there a problem with the county's own site not kind of kicking them out, going, sorry, you're not 75, you can't do this?
Can't do it.
So there's no story here. The story here is that people are not registering properly and they're not eligible, and we're turning them away when they don't meet the criteria. So we make our best effort in going through and looking at the once people make appointments, we try to estimate, for example, we can't really restrict it by age because there are other folks within the 1A category who meet that criteria but aren't 75. And so we can't just discriminately go and just say everybody who's not 75, lock them out of the system. So we do make as best effort as we can based upon the information that has been put in terms of type of employment and age, to screen as best as we can possibly to delete and cancel those appointments before they show up. And again, in the form like this, we are very clear to say who is eligible and who is going to be vaccinated at those particular sites. It's very clearly laid out in terms of what we're saying here publicly, as well as through press releases, as well as it's very clear on our county website. It's laid out who's eligible and who's getting vaccinated at which sites. And so we would encourage our residents, if you have questions, to take a look at all of those particular things, to get information and confirm that before registering and showing up at the sites.
Okay, quick follow-up. Quince Orchard on Tuesday, my understanding is there were 1,200 slots. Only 600 people showed up. That day was apparently set aside for MCPS or to try and get MCPS staffers vaccinated. Do you know why you didn't get the level of participation and number of people showing up that you wanted?
So Kate, let me clarify you right there. That's not true. So county sites, I will repeat again, are prioritizing 75 and up.
Okay, so were there 1,200 slots and only 600 showed up?
I don't have the information in front of me, but your statement related to that being a dedicated day for MCPS is not accurate. We've been very clear, the county site is for 75 and up. And so there are days where it's not just people not showing up, it's having to clear hundreds of people who are registered for appointments that they're not eligible for. And so
Right.
That creates a difference in terms of the number of doses available that we're able to launch and give out versus the number of people who've actually registered. And part of that, to help address that, is part of why we're trying a couple of different strategies to be able to go in places that are filled or heavily utilized by the individuals who are our priority group, to alleviate some of that, where we're not having appointments we have to cancel on the day of, or where we have hundreds of people who aren't eligible taking slots that otherwise those people would be able to utilize.
Got it. Okay, thank you very much.
Next question is from Marcella from Univision. Marcella? Okay, she didn't have a question. Okay. Last question we have here is from Caitlin from Bethesda Beat for Dr. Gales.
Hi, good afternoon. Thanks for your time. You've touched on both of these, but I just want to ask clearly and explicitly. Two parts. First part, what are your thoughts about MCPS no longer holding its reopening to meeting those metrics that you recommended or helped develop in the fall? And then the second part, are you of the opinion that educators and school staff should be fully vaccinated before returning to buildings?
Well, I will say this. I think that our colleagues at MCPS have had a tough job throughout the pandemic, balancing all of these different factors, and have listened to the guidance that we've provided. I think that the parameters that have been put into place, again, are consistent with, they were consistent with the state guidelines until the state made a decision to take out any types of metrics related to reopening. We continue to provide them guidance in terms of certainly their approach to bringing back smaller groups of students, particularly those in younger ages where we have seen lower rates of transmission, as well as, again, to emphasize from the earlier conversation, the recommendation of including testing in some capacity with bringing folks back, as well as they have prioritized their staff to get vaccinated based upon those who are coming back into the classroom sooner versus later. So I do think it's important to have some level of protection on board for teachers. I know this was a controversial statement that the CDC director made a couple of days ago or last week to say that vaccination isn't required. I don't necessarily agree with that. I think we need to do everything we can to provide as much protection as we can for the staff members who are going back into those places. And it's certainly the expectation of we would want to provide as much protection as we can for any of us going back into the workplace who may be exposed. So I hope that answers your question. We continue, Dr. Stoddard and I meet with representatives from MCPS on a weekly basis and answer a number of questions they have related to, those types of things. And the last thing I would say is the county executive mentioned, there is back in July, Dr. Stoddard and I did a site visit to one of the MCPS schools to talk about their reopening plans and to talk about the different things that they were going to put into place and have put into place. And we remain confident that a number of those things then, as well as a host of other things that, again, the county executive mentioned in terms of a to-do list, in terms of things that you put forward, would keep students and staff safe. But again, the big game changer is the presence that at least a significant portion of those included in that space will have at least one dose of the vaccine on board as added protection.
About that, the testing protocol that you said you were working with MCPS to help develop, do you have any more information about what that might look like? I don't know if anybody has really delved into what that might be.
No, they continue to work on those details, and we've provided some guidance and recommendations and suggestions on how to stand that up. But it continues to be a work in progress. But again, I know that I can say that it's something that they have been working on for a number of weeks as an additional component to add, protection and safety for their staff and students.
Okay, that's our last question, but we do have a few minutes. Aisha, you wanted to do a follow-up, or have you gotten your answer?
No, the other thing I just wanted to ask, I know you talked about a little bit about the criticism you guys have been getting, and we saw that there was criticism coming from the state claiming that the county isn't doing, quote unquote, such a great job with the rollout of the distribution of the vaccine. I guess any comment on that? I mean, obviously there's some disagreement there, but I'd like to hear it from you guys, Dr. Gales or Dr. Starter, whoever wants to answer.
Well, as I referenced in my opening comment, health departments have become a punching bag unfairly in terms of other data points. You can cherry pick data and make it fit the narrative that you want to put out there. But if we look at our information, up until last week, we're distributing 99.6 to 99.8% of the doses we received as a health department. And concomitantly, our doses were cut within each of those weeks. So we are in a position, I'll say this, we're not interested in tweeting about data points. We're interested in coming up with comprehensive solutions and strategies that will get our residents safe and get them vaccinated. And anytime anyone wants to engage in a conversation, particularly that is inclusive of fair and equitable practices to do so, we welcome that opportunity.
Barry, I had asked a question on the chat, but I'm not a reporter. Quick question.
No, thank you, but we typically take questions from the media.
Okay.
We're at 12:58. If you'd like, I didn't see your question in the chat. If you put it in there, we can, and your email address, we can certainly respond back to you.
I think you can do it in one sentence if I can try to ask the question,
Yeah.
which is only do you prioritize of the 75 plus group, do you prioritize people who have chronic diseases? That's all.
So I will answer that, but I also wanted to finish a comment with Aisha's question. Part of the frustration that we in the public health world have is the continued politicization of the pandemic response. And what we're just asking is for a meaningful discourse and conversation related to how we improve, how we deliver services to our residents, and how we create systems that are fair and equitable. And that's what our priority is. That's what our focus is. And that actually ties into the question from Mr. Lecter related to the prioritization. So right now we aren't prioritizing within that 75 plus group. We're trying to get the doses out to everybody who's 75 up as quickly as we can. There is been to some degree some prioritization. So for example, the nursing home residents and folks in long-term care facilities have received vaccines as part of the state program at earlier stages in the response than just the general population over 75. So there has been some factoring in, in terms of medical condition within that. But beyond that, we don't have any prioritization as it currently stands.
Thank you.
Okay, it is now 1 o'clock. Want to thank everyone for coming out today. Thank the county executive, Dr. Gales and Dr. Stoddard, for their responses. We'll see you back here again next week with more answers to your questions about the vaccine and COVID. Thank you very much and stay safe out there.
Thank you all.